And remember, we're not only in a national economy, we're in a worldwide economy. And what has every business across the world done? They've reduced the overhead cost of operating a business so they can get the services or the product to the customer. Well, that's what we need to do with education as well. Whatever adjustments we make in education, we're going to have as little impact as possible in the classroom. And that's what, for example, our education reform bill is all about, putting the resources where the people are really making a difference. That said, as far as Medicaid, this is, again, Speaker Cannon was a superstar last year. He really elevated the debate. He talked about how we fundamentally change the way that Medicaid is delivered. It has to be patient-centered again. What we're so disappointed what's happened in Washington is become government-centered. And I'm excited about the proposal that he has put out. We've put out a proposal as well in the Senate. And it's trying to move people towards higher quality of care, more access to care, and trying to stay out of what they call an acute care situation, which means stay out of the emergency room. I think his proposal provides that. I think the proposal coming out of the Senate provides it. I expect to have a work product that not only saves money, that's important, yes, but the most important thing is a higher quality of care and also aggressively going after fraud. Again, I applaud the Speaker. We're trying to keep up with him on this one. He's done a masterful job, and I expect our different members to get together, work out a proposal that benefits the patient and the taxpayer in the long run.
If I can add to that, I also want to say, though, President Haridopolos set the tone last summer by doing his Medicaid tour, where he actually went in, I was at the kickoff, went into a clinic, and there are some good, innovative things we can do, and I think Chair Negron and the team in the Senate have got some great ideas as well. And so we're looking forward to, again, as I said, hopefully each ideas chambers bring the best of their ideas to the final package, and we end up with something that really benefits, like Mike said, the patients and Florida overall.
Well, just one issue that I'm sure you've heard a lot about is whether or not in the future mental health will be covered in Medicaid. And that's been written about a lot. What's the story on that?
I'll say this. I've got a nephew with autism, so I'm highly sensitive to the developmentally disabled population. And that, nursing home care, there's some very sensitive areas because these are people who have great needs and they're expensive. One of the things that I like about the House approach is that care is specialized, but it can still be managed if you are smart about it. And if you get the right provider connected to that particular patient, that can be done. Other states are doing it successfully. And so it's preferable, I think, to do that than just a massive rate cut, which is what we've dealt with in the past. That doesn't serve anyone's interests. So I'm pretty optimistic that that will be covered at the end of the day effectively through Medicaid. But again, we'll have to wait and see. But I think other states have done it successfully, and our job is not to copy other states, but frankly, to use a Florida approach that's even better.
You can imagine the people that are on the receiving end of Medicaid are really concerned when they know that, of necessity, the legislature has got to be concerned about the cost of Medicaid, and they hear the word reform and they think that they're going to be denied services of some kind, either through a managed care system or something else. What do you say to people, I know you know, and your wife treats people that are concerned about, losing service? At the end of the day, what do you think is going to happen?
Well, first, I do think we'll have the reforms in place by the end of session. But look, I don't blame folks. This is a difficult time. There's a lot of uncertainty in the air, to say the least. To try to alleviate those concerns, last year, I know in the Senate, I actually served on the committee, 40 hours worth of testimony. As the Speaker mentioned, we went out on the road in rural and urban areas across the state, listening to people, not talking to people, listening to people, which really helped us craft a message and, more importantly, a policy we think will work. But also, we have to understand, remember what's happening in less than 3 years. We're going to see an expansion of Medicaid of up to 50%. If you think that Medicaid is crippling the budget today, you can only imagine increasing the number of folks on Medicaid from roughly 3 million today to 4.5 million people. And what we all agree on, left and right and center, is that Medicaid is a big cost shift. The reimbursements don't really come in, and that means anyone who has a private insurance plan is paying an artificially higher price. This is why we're trying to bring fundamental reforms and put some accountability measures in place, aggressively go after fraud. Again, try to get on the front end of the issue. If we can move towards these primary care clinics, for example, people don't go to the emergency room where it costs 10, 20 times more for the same type of care. This is a common sense approach. I know some people are apprehensive, but if we don't make these changes this year, there won't be a system worth a darn in a couple of years because the extravagant increase in numbers of people in the system, let alone the coverages, they'll eventually wipe out the high-quality overall healthcare system we have in America today.